Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, and I'm going to be covering gastric esophageal reflux disease as well as colon cancer. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Press that like button now so you don't forget. Subscribing to my channel if you haven't done so already, and pressing that red notification bell so you'll be notified every single time a new video is released. Don't forget, you can find me covering a variety of nursing topics almost daily on my other social media platforms such as TikTok, Instagram, and Facebook. I now offer next generation NCLEX reviews as well as one-on-one tutoring sessions and even consultation sessions. You can reserve your spot right now by going to my website, nexusnursinginstitute.com. And while you're there, be sure to check out the audio lessons I have available. All right, guys, let's get started. GERD and colon cancer. Which diagnosis is the result of an incompetent lower esophageal sphincter that allows gastric contents into the esophagus? Would it be peptic ulcer disease, diverticulosis, gastric esophageal reflux disease, or colon cancer? Which diagnosis is the result of an incompetent lower esophageal sphincter that allows gastric contents back into the stomach? Okay, guys, and the correct answer is GERD. So what happens is that lower esophageal sphincter, also known as a cardiac sphincter, it doesn't close all the way. And so the gastric contents, including hydrochloric acid, creeps back up into the esophagus. Now, the problem with this, the esophagus was not made to be able to handle hydrochloric acid. The lining, what happens when the hydrochloric acid comes into the esophagus, it causes burning. And so the patient will have what's known as heartburn, that burning sensation. True or false? Heartburn and feeling of fullness before eating are clinical manifestations of GERD. Is this true or is this false? Heartburn and feeling of fullness before eating are clinical manifestations of GERD. True or false? Wow, this was almost half and half. So the correct answer is false. All right, guys, on the live, can you tell me the one word that made this false? What is one word in that sentence that made this statement false? Very good. That one word is before. And I did this on purpose. I want to show you something because NCLEX does this a lot. They will give you an answer that looks so beautiful, but only one thing is wrong. One word is wrong. And the answer is so beautiful, you want to keep it because there's only one thing that's wrong, right? It doesn't matter. Even if it's only one thing that's wrong in the entire statement, that one thing that's wrong makes the entire statement wrong. And so you have to go with false. You have to not choose that as your answer, regardless of how beautiful that answer choice is. Now, that feeling of heartburn and fullness that the patient has, those are clinical manifestations of GERD, but they have that after eating, not before. Because remember, the whole problem is that you just ate and the hydrochloric acid in your stomach that's supposed to break down the food, it's creeping back up into the esophagus because the lower esophageal sphincter or the cardiac sphincter has not closed completely. Select all that applies. What are important nursing interventions and patient teachings for GERD? Now, this is select all that applies, so you're going to treat this as true or false. What are the important nursing interventions and patient teachings for a patient with GERD? Eating small, frequent meals, avoiding foods like chocolate, peppermint, tea, coffee, spices, remaining upright for at least an hour after eating, avoid eating 3 hours before going to bed. Being in the semi-prone position is the most effective for sleeping. And sucralfate should be taken an hour after meals. Which would you choose to teach your patient regarding GERD? Okay, and the correct answer choice are the first four. You're going to teach the patient to eat small, frequent meals. And guess what? That is across the board. When it comes to GI, any GI issues, it's always going to be small, frequent meals. You're going to teach them to avoid triggers for reflux and irritants, such as chocolate, peppermint, tea, coffee that has what? Caffeine in it, spices. Avoid them. You're going to teach them to remain upright for at least an hour after eating, because what happens after the person eats and they lie down, that pressure of them lying down puts pressure against that lower esophageal sphincter, against that cardiac sphincter, and it might open up just a little bit, but enough for the gastric contents to creep back up into the esophagus to cause pain and burning. You're going to teach them to stay sitting up for a good 3 hours after you're going to teach them to make sure that they stay sitting up, and we don't want them lying down right after they eat. Avoid eating 3 hours before going to bed, because what do you do when you go to bed? You lie down, right? Exactly. What we don't want is the food that's in the stomach to be pushing against that cardiac or lower esophageal sphincter to open it up so it could creep into the stomach. Into the esophagus. Those were the correct answer choices. The two answer choices that were wrong was semi-prone position. Really? Patients with GERD, we're trying to keep the food in their stomach. So we want them to, even when they're sleeping, we want their head slightly elevated. We're going to teach that patient to sleep with their head on 6 to 8 inch blocks because we want it elevated. And last, sucralfate should be taken 1 hour after meals. What is that sucralfate going to do for you if you take it after meals? Sucralfate is a protectant, okay? It protects, it acts as a barrier, okay? It protects the gastric mucosa. So what you're going to do, you're going to take that medication. You're going to teach the patient to take the medication an hour before meals, because what it does is it coats the lining of the stomach. So when the patient actually does eat, the hydrochloric acid that's supposed to be eating away at the food doesn't burn a hole through their stomach. So they're going to take the sucralfate before, an hour before meals, not after. Which class of medications neutralizes the acidity of stomach contents? Is it antacids? Is it H2 blockers? Is it PPIs? Or is it protectants? Which class of medications neutralizes the acidity of stomach contents? You guys are doing great on the live. Very good. Antacids. Let me tell you something. The minute you see neutralizes, you know they're talking about antacids. And you absolutely need to know the actions of each class of medications. You got to know the actions of the antacids versus the actions of the protectants versus the actions of the H2 blockers versus the actions of your PPIs. If you are currently in school, you're taking med surg, you're in GI, and you're covering this, I guarantee you're going to get at least one question on the action of the medication. You have to know the action, the difference in the actions, okay? So when you see neutralizes acidity, what they're talking about is the antacids. Very good. Which class of medications act as a barrier to line the GI tract? Oh, I gave you the answer already. All right, what's the answer? Is it antacids, PPIs, H2 blockers, or protectants? What do you guys say? Very good. How did 6 of you choose the wrong answer when I gave you the answer? The protectants. Remember the protectants such as the carafate, the sucralfate, you take an hour before you eat and it lines, it actually coats it coats the lining of the stomach to protect the stomach from the acidity from the hydrochloric acid. True or false? Omeprazole is a PPI and it should be taken before meals. Is this true or is this false? Very good. This is true. Omeprazole is a PPI. You take it in the morning before you eat, and many patients that take it twice a day, you want to take it before meals. But the point is you want to take it before meals because that PPI is what's going to help decrease. Let me say, sorry guys, I have this thing keep coming on my screen. That PPI is what's going to help decrease, that the symptoms that the patient has with GERD, such as that heartburn that they have, which is due to what? The hydrochloric acid, that acidity. Select all that applies. What are the adverse effects of proton pump inhibitors, the PPIs? What are the adverse effects? Here are your choices: constipation, tinnitus, that's the ringing in the ears, anxiety, diarrhea, vertigo, confusion. What are you going to choose? Select all that apply. What are the adverse effects of PPIs? And something I didn't put on here, but I'm going to tell you, this is an adverse effect. And I know it sounds weird, but heartburn, right? You're taking PPIs for the heartburn, but it is a possible adverse effect, just so you know. Keep going on the live. Don't give up, guys. Okay. All of them. All of them. Constipation, tinnitus, anxiety, diarrhea, vertigo, confusion. All of these are possible adverse effects with the PPIs. Ranitidine, nizatidine, famotidine, cimetidine. These are all examples of which drug class. They end in the idine. Which class? Are they antacids, PPIs, H2 blockers, or protectants? What do you guys think? Very good. H2 blockers, when you see them end in the idine, you need to be thinking of the H2 blockers. And remember, the H2 blockers, I don't have it on here, but I'll just tell you the action of it, it decreases the acidity, the acid secretion, I should say. When it comes to your H2 blockers, the action of that drug is to decrease the acid secretion. Think about it. With decreased secretion of acid, decreased heartburn. The highest incidence of colon cancer. So we're switching gears. We're talking about colon cancer. The highest incidence of colon cancer occurs in which group of people? Would you say older than 30, older than 40, older than 50, or pediatric patients? In which group of people do we see the highest occurrence of colon cancer? Older than 50. And when it comes to colon cancer, I want you to think of it in this way that the older you are, the higher your risk, just because you've had more time on this earth to eat those carcinogenic foods and for them to actually change the lining of the GI tract. Older than 50. Select all that applies. Which types of diet may be a factor in prevention of colon cancer? Select all that apply. High fiber, high fruits, high veggies, high fat, high red meats. Professor D, I have no clue. I give up. What do you think? Congratulations, Nee. I see on the live you're the number 10 player on the list. Thank you, iChannels. Thank you. We're talking about the type of diet to prevent colon cancer. Okay, let's talk about it. High fiber, high fruits, high veggies. Earlier today, I did an NCLEX review. And during the NCLEX review, there was a portion where I was talking about, just tips and strategies. Let's say you have no idea what the answer is. You don't even have any clue what you're looking at. How can you increase the chance of getting the answer correct? And one of the things I talked about was you got to look at umbrella answers. If you see an answer that includes another answer, choose that. It makes sense. So look, we have high fiber right here. Fruits are high in fiber, and so are veggies. So why would you not choose all three if you saw them? High fat, nope. Actually, high fat diet, that increases the risk of colon cancer, and so does the consumption of meats, especially red meats. It takes a long time to digest, so it stays in the GI tract for much longer. And the longer it stays in the GI tract, the more time it has to actually cause changes to the tract. So when it comes to diet for prevention, it's high fiber foods. Why? I want you to think about it. What does fiber do? Fiber says, come with me. Fiber says, come with me, come with me, come with me, come with me. Everywhere fiber goes, come with me, come with me. So all of that crap that you eat that's sitting in your GI tract, when you eat foods that are high in fiber, fiber pulls all of that crap with it. So when you have a bowel movement, you can evacuate your bowels and it doesn't just sit there in your GI tract and have time to eventually change the lining of the tract, okay? That's why fiber is so good for you. True or false? Cruciferous vegetables include cabbage, broccoli, cauliflower, cabbage, kale, and Brussels sprouts. Is this true or is this false? This is true. This is very much true. Professor D, why are we talking about cruciferous vegetables? Because that's going to be part of your teaching. When you're teaching about the high fiber diet, you're going to teach about cruciferous vegetables, and you need to know what that includes. Which test is used to evaluate the effectiveness of chemotherapy in the patient with colon cancer? Is it digital rectal exam, colon biopsy, barium enema, or carcinoembryonic antigen, CEA? Which test is used to evaluate the effectiveness of chemotherapy in the patient with colon cancer? I'm going to have fun with this one. All right, let's talk about it. Most of you guys chose colon biopsy. Colon biopsy is used for what? Diagnosis. We want to know beyond the shadow of doubt what the patient has. We'll do a biopsy because we're actually taking a piece of that tissue. We're going to do histologic studies, right? We're going to know what it is. But look at what the question's asking us. It says, which test is used to evaluate the effectiveness of chemo in the patient that's already been diagnosed with colon cancer? So we already know what our patient has. We already did that biopsy. We already did the biopsy. So it's not the biopsy, that is diagnostic test. It's not going to be the digital rectal exam, that is a screening tool. And it's not going to be a barium enema, which is a diagnostic tool, right? But CEA, that's what we use. We know the patient already has a colon cancer. We're treating them, but we want to see, is the treatment actually working? Is it actually killing these cancer cells? We're going to look at the CEA. Select all that applies. What are the clinical manifestations of colon cancer? Select all that applies. Would you say rectal bleeding, nausea, vomiting, weight loss, cachexia? Cachexia, that's when like the patient's wasting away. Family history of cancer, history of polyps. What do you think are the clinical manifestations of colon cancer? I should say clinical manifestations I'll leave it at that. Or patient history. Okay, all of them. Rectal bleed, and let me tell you something about rectal bleeding. The minute patients talks about rectal bleeding, in the forefront of your mind, that's one of the things you need to be thinking about. If I have any NP students on here, this is on your test when you're taking your boards to be a nurse practitioner. That is definitely going to be on your list of differential diagnoses when you see rectal bleeding, just letting you know. Other signs and symptoms, nausea, vomiting, patient losing weight, and telling you they haven't been trying, they're just losing weight. Them having a family history of cancer because genetics, right, that places them at risk, and history of polyps. Having a history of polyps, that's a high risk for cancer as well, colon cancer. If your patient ends up getting a colonoscopy, which type of diet should be ordered? High calorie, high protein, low calorie, low protein, high carb, low fat, low carb, low fat. And I'm so sorry, I said colonoscopy, but I meant guys, tell me in the live, what's it called when they have the, not colonoscopy, when they have the opening in their GI tract? What is it? Colostomy. Thank you. I put colonoscopy. I'm so sorry, guys. I meant I can't pronounce it. Colostomy. Colostomy. When they have like a colostomy and they have the colostomy bag to actually catch the fecal matter. That's what I was trying to say. So your patient has a colostomy, right? So we ended up having maybe, that portion of the GI tract, it was diseased, it was cancerous, it had to be removed. And so now they've got a colostomy. Now the fecal matter has to collect in that colostomy bag. That patient who's had a colostomy, this is a surgical procedure. This is an invasive procedure, okay? The patient who's had a colostomy, what type of diet would be ordered for this type of patient? And the correct answer is high calorie, high protein, a diet. Oh, hardly anyone even answered this question, but let's talk about it. High calorie. What do we know about calories? Why are calories important? It gives you energy, energy fight infection, energy for healing, right? And high protein. When people think of protein, they usually think of muscles, which proteins absolutely helps to build muscle, but protein is also wonderful for wound healing. This patient's got a new wound, so they're going to be on a high calorie, high protein diet. True or false? Pain is an early sign of colon cancer. Is that true or is that false? Thank you, Liga Dinga. Pain, is it an early sign of colon cancer? Thank you, iChannels. False. False. Matter of fact, when it comes to cancer, this is just a rule of thumb, pain is always last. That's why cancer is so deadly. Every other disease or disorder, patient will feel pain at the beginning. So they feel pain, they go to the doctor because nobody wants to live with pain. So it's caught early. But when it comes to cancer, pain is one of the last symptoms. By the time the patient feels pain, it's already metastasized throughout the whole body, right? And so that's one of the reasons cancer is so deadly, because it's not caught in time. Pain is a late symptom, not an early symptom. Okay, last question. True or false? Rectal bleeding is an early sign of colon cancer. True or false? I'm so sorry, I gave you the answer already. Is that true or is that false? Rectal bleeding, is it an early sign of colon cancer? True. Absolutely true. Rectal bleeding, as I said before, if I have any nurse practitioner students, this is going to be on your test. Make sure you know it. That is going to be on your list for differential diagnoses. The minute you see rectal bleeding, you need to be thinking of colon cancer. It is an early sign. You guys did such a great job. Let's see how well you did. Okay, guys, thank you for watching this video. Please let me know what you thought about the video. Let me know what you'd like to see me cover next or more extensively, and in what format. Do you want it in question and answer format, activities format such as this Kahoot, or would you like it in a lecture format when I'm teaching out of the book? Also, again, I'm teaching next generation NCLEX reviews. I'm doing one-on-one consultations and tutoring sessions, and you can reserve your spot right now by going to my website, nexusnursinginstitute.com. And while you're at it, be sure to check out the audio lessons that I have available. Almost daily, you can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, and Facebook. Thank you so much for watching. You guys catch me on the next video.